Assalamualaikum everyone, welcome back to this channel. This is me Anived and you are on the channel of Medicare. So as you know that we have started the lecture of pathology and in which we are going to study about the inflammation. So as you know that we are discussing about the inflammation. In the previous lecture I have discussed about what is inflammation. We have shortly introduced the inflammation, what it is. So we have discussed that inflammation is a body protective response. It is occur when we our body has some tissue injury, when we have some infection, and then it happens to us, and the body is going to protect us with the help of this inflammation. And our inflammation involves our immune cells, our blood vessels, some proteins and mediators. Then we have discussed some functions of inflammation, that it is very important not only to kill these kind of microbes or the offending agent, but also it used to heal and repair of our body. Then we discuss some types of the inflammation, acute inflammation and the chronic one. We have discussed acute inflammation is a initial rapid protective response that occurs as a consequence of tissue injury and the some damage. Then we have studied that the acute inflammation, it is self-limited and it is mild. Its duration is very low, onset is very low. Its cellular infiltration mostly consists of neutrophils, which are also called as polymorphonuclear leukocytes. Then we have discussed that its signs are very mild and it is self-limited. While the chronic, it is very severe and progressive in nature, and whenever our acute inflammation or our initial response fails, then the chronic inflammation starts. And in always in chronic inflammation, there will be a progressive damage within the tissue or the progressive inflammation. And the development and the onset of inflammation, you know that it is very long, because chronic word mean prolong. So to treat the chronic inflammation, it is not easy to cure it within very less limit time. The chronic disease or the chronic inflammation take the longest time period to treat. And the cellular infiltrate in case of the chronic inflammation mostly consists of monocytes, macrophages, and the lymphocytes. And their signs and symptoms is that they are more progressive and severe in nature, and they have tissue injury or fibrosis. These kind of things happens within them. And the signs of the acute inflammation is that it is very prominent, while the signs of chronic inflammation are very less. So these are some major things that we have discussed. We also have discussed the examples of the acute inflammation. Like the acute inflammation is the acute respiratory syndrome, asthma, glomerular nephritis, and the septic shock. These are the acute inflammatory diseases. And some chronic diseases are like arthritis, asthma, atherosclerosis, and pulmonary fibrosis. Then we have discussed some causes of inflammation, like the infection. A lot of microbes cause the inflammation. Tissue necrosis, whenever we have ischemia, low blood flow, then the tissue damage. Whenever we have trauma, any physical and chemical injury, then our tissue is damaged. Some foreign bodies are also came in our body, like the lipid in the case of metabolic syndrome. Metabolic syndrome is a disorder in which our body metabolic activities are not performing well. And some urate crystals are also came when we have gout disease. So gout is a inflammatory disease. Then we have another disease which is like arthritis, or or you can say atherosclerosis, in which cholesterol crystals are formed. And in case of Alzheimer disease, some amyloids deposits in our brain. Some immune reactions also, like the hypersensitivity, allergy, and the autoimmune diseases, they can also cause the inflammation to you. Then we have discussed some cardinal signs of inflammation: heat, redness, swelling, and pain, and the loss of function. Calor, rubor, tumor, delor, and functionalolosia. Who discovered it? We have discussed all these things. We have discussed the component of inflammation, the features of inflammation, the whole mechanism of inflammation. These are something that we have discussed in the previous lecture. Now we are going to start the detail of acute inflammation, that what it is. So before I'm going to start, we have, a little bit start the acute inflammation. We have seen that our acute inflammation is actually the type of immune reactions. So immune reactions occurs when our immune system activates or some kind of antigen enter into our body, then it will become triggered. And it has three types: acute inflammation, chronic inflammation, and the immune mediated inflammatory disease. So, now we are going to start about the acute inflammation, which is a quick inflammatory response occur after any injury or after any infection. So we have seen that in the acute inflammation, we have two types of component: vascular changes and the cellular event. In the vascular changes, our vessels vasodilate, they produce redness and the warpness. Then they increase the vascular permeability, due to which the edema will occur, exudate and transudate will occur. Then we have endothelial activation, due to which the leukocytes attach to the walls of the blood vessels, and there will be easy for us to migrate them. Then the second process is the cellular events, in which our cells activate, and they cause the migration of leukocytes, and they cause the activation of leukocytes. So how they are migrates, actually white blood cells move in the bloodstream and they accumulate there, and how the leukocytes activates. So actually their activation occurs, the leukocytes and the neutrophils activate, and they eliminate the harmful cells. Neutrophils, they are the primary blood vessels that involved in the acute inflammation. So जब भी आप बात करेंगे एक्यूट इन्फ्लेमेशन की, तो न्यूट्रोफिल्स एक वाहिद वाइट ब्लड सेल है जो कि बहुत ज़्यादा यूज़ होगा. इतने लिम्फोसाइट्स यूज़ नहीं होते, इतने मैक्रोफेजेस यूज़ नहीं होते. एक्यूट इन्फ्लेमेशन में न्यूट्रोफिल्स का ज़्यादा रोल होता है, ये याद रखना है, क्योंकि ये क्विक रिस्पॉन्स देते हैं. तो लिम्फोसाइट्स का जो रिस्पॉन्स है वो डिले है, तो वो क्रॉनिक इन्फ्लेमेशन में काम आते हैं. इसी तरह मैक्रोफेजिस भी. लेकिन जो न्यूट्रोफिल्स हैं, दे आर वेरी क्विक इन द रिस्पॉन्स, सो दैट्स वाई वो एक्यूट इन्फ्लेमेशन को रेगुलेट करने के लिए यूज़ होते हैं. फिर उसके बाद हमने देखा था स्टिमुलाई क्या है एक्यूट इन्फ्लेमेशन के. वी हैव सीन ऑल द कॉजेज ऑफ इन्फ्लेमेशन आर द स्टिमुलाई ऑफ एक्यूट इन्फ्लेमेशन. Then we have discussed some features of acute inflammation, like the vascular reaction, in which vasodilation is occurring or increase in the fluid leakage is happening at the site of the injury, and the RBC accumulate there. That's why that site appears red and more warmth and more swallowed. Second is the cellular reaction, which is that all the kind of white blood cell like the neutrophils, lymphocytes, mostly neutrophils, they move toward the site of the injury in case of acute inflammation. But when we have chronic inflammation, then mostly lymphocytes and macrophages travel at the site of injury. So this is the major thing that could be asked in the paper, that could be asked to you in the viva question. So you should definitely know about it. And the major common signs and symptoms of the acute inflammation is the redness, warmthness, swelling, edema, and the neutrophils accumulation at that side. So we have seen all these things. Now we are going to start the detail of the components of acute inflammation. The first component of acute inflammation is our vascular changes. The changes that occur within the blood vessels. Okay, whenever any injury happens, for example injury happens on your skin, so the blood vessel that present at that site or at that cut area will begin to vasodilate. So how all these vasodilation or these things happening, we are going to discuss it in whole detail. So first of all, this vascular changes is a initial response. Always acute inflammation start with a single word, and which is initial response. So it is a first response to our any injury or any infection. So initial response in response to the infection or any injury, and what it importance is, what thing it is doing, why vascular changes is the important part of acute inflammation. So the things or the function it is doing are very important, and what things it is doing. So it is bringing your blood cells at the site of the injury, so it is accumulating your rbc, your wbcs, and the other blood cells at the site of injury. And it is accumulating not only the blood cells but also the proteins, because we need proteins, we need white blood cell, red blood cell to kill the microbe and to heal the body. So now healing is not start here, but yet we need all these things to balance up. So we need white blood cell, red blood cells, we need proteins, and we also need increased blood flow. Blood flow should be fast, not slow. It should be fast. And that's why the vasodilation occurs. So whenever vasodilation is occurring, your blood flow will increase. Okay, first of all, we are going to see how the vasodilation is going to occur. So the major thing in the vascular chain is your vasodilation. VD mean vasodilation, and how the vasodilation is occur. Now we are going to see every step of it, how the vasodilation will occur. So the first step of vasodilation is our transient vasoconstriction. Transient vasoconstriction. Transient mean temporarily, mean short time के लिए vasoconstriction होना. I have said to you when in the previous lecture when we are discussing the mechanism of acute inflammation. In that topic we have discussed that primarily your vessels don't vasodilate. The first response to an injury or to an inflammation is the vasoconstriction. Why the constriction is important? For example, let's suppose that I got the cut at that part, and now my blood vessels at that area, they will not vasodilate. If they vasodilate, there will be the over blood flow through that area. First they will vasoconstrict so that there should be very less blood loss, and then they start the vasodilation. So that's why the primary response is temporarily vasoconstriction to decrease the blood loss. So initially vasoconstriction will occur and it only lasts for few seconds, not more than. So its duration is less than seconds. It takes just few seconds and then it will vanish. Okay. Second step of vasodilation is the arterial vasodilation. Arterial vasodilation mean vasodilation occur within your arteries, not the veins. That's the important. The vascular permeability occur in the veins, while the vasodilation occurs within the arterials. So हमेशा arterioles dilate in themselves and veins also dilate themselves, but uh, the arterial dilation is the major purpose, major thing. And why it dilates itself, why? So the mast cells are present within our cells, they release histamine, a mediator. And histamine, it is very important in the process of vasodilation. It dilates the vessel, increase their diameter, and due to histamine it increase the blood flow of that vessel. So blood will flow quickly, providing more rbc, more wbc, more protein, and more beneficial substances that we need at that area. And due to more blood flow, we feel that area more red and more warmth. So these are the signs that the acute inflammation is gonna to occur. And then the third component of vascular changes is your vascular permeability. So your vascular permeability is also increased, causing the fluid leakage or the edema like situations. So it causes the swelling at that area. These are the signs of your inflammation. So how the swelling is occur? So this process is called as diastasis. What this process is called, I'm writing a very important word here, diastasis. So what it is, when your fluid loss, okay, whenever like this is a blood vessel, and due to some infection or inflammation, it dilates itself, it increase its diameter like that. First its diameter is small, now it is large, and now it has more pores, so it allow more water, this is the water, to move outside. But you know, in our blood some proteins are also present which are of much bigger size, but the water move out, all the water is moving out, so all this water is gone. Now more protein or more rbc are present within your blood vessel, because water is outside and more concentration of rbc will be inside the blood vessel. So what it is doing, it is increasing the viscosity of your blood, not increasing the flow, but it also increase the viscosity, because now it has more rbcs, more wbcs. that's why your blood will become more viscous, जिसे हम उर्दू में कहते हैं गाढ़ा हो जाना, तो आपका खून और ज़्यादा गाढ़ा हो जाएगा, ठीक है. So whenever the blood viscosity increase, the small vessels that are they dilates, and they are packed with the WBCs, and this process is called diastasis. So at this process the blood is decrease its speed and it will diastasis. We see the stack of RBCs. So this process is called diastasis due to more outflow of the liquid of the water out of the blood vessels. There is an increase in the concentration of rbcs and the other blood cells that cause the increase in the blood viscosity. And this process is called diastasis. Okay, so this is the major thing. Then we have some differences between the exudation and the transudation. We will see that, and then we will discuss the mechanism of vascular permeability, how it is occurring, and then we will start the cellular events. So first of all, how this exudation occur? Exudation means the excretion of water outside the blood vessel. So how it is occur, and the other process is transudation. So these are the two processes by which the blood, or you can say the fluid, move outside a blood vessel. And we will see the difference between the exudation and the transudation. So first of all, we have exudation, and the second is transudation. You can say exudates and transudates. We will see the difference between them. So first of all, exudation, this is a fluid that release into the extracellular spaces. तो ये क्या है, एक फ्लूइड है जो कि एक्स्ट्रा सेलुलर स्पेसिस में आएगा. ये ब्लड वेसल है, इसमें से एक फ्लूइड ने बाहर आना है. लाइक यहाँ पर पोर्स हुए हैं और ये फ्लूइड इसके अंदर था, उसने बाहर आना है एक्स्ट्रा सेलुलर स्पेसिस के अंदर. सो ये वाली जो सारी स्पेस है जिसके अंदर फ्लूइड बाहर आया, उसे हम एक्स्ट्रा सेलुलर स्पेसिस कहते हैं. एक्स्ट्रा सेलुलर स्पेसिस, ECS भी आप इसे कह सकते हैं. And it has more protein concentration or the water concentration, and it only occur in the case of acute inflammation. So इसके अंदर प्रोटीन सिर्फ ये नहीं है कि वाटर है, कुछ वो प्रोटीन्स जो इन पोर्स से पास कर सकती है जिनका साइज़ इस तरह का है. कुछ का तो साइज़ बहुत ज़्यादा होगा ना, कुछ प्रोटीन जो ज़रा छोटे साइज़ की हैं वो इसमें से बाहर आ जाएंगी. तो यहाँ पर प्रोटीन की कंसंट्रेशन ज़्यादा होगी और वाटर भी ज़्यादा ही होगा तकरीबन, लेकिन प्रोटीन की वाटर से बहुत ज़्यादा होगी, वाटर प्रोटीन की निस्बत कम होगा. ठीक है। और ये हमेशा एक्सुडेशन का प्रोसेस एक्यूट इन्फ्लेमेशन के में होता है। अगर कोई आपसे पूछ लेता वाइवा के अंदर कि एक्सुडेशन हो रही है और ये आपको क्या लगता है ये एक्यूट इन्फ्लेमेशन है पेशेंट को, ये क्रॉनिक इन्फ्लेमेशन है या कोई इम्यून मेडिएटेड रिएक्शन है, तो आप फ़ौरन कहेंगे कि ये एक एक्यूट इन्फ्लेमेशन है। एक्सुडेशन मेजर साइन है कि ये एक्यूट इन्फ्लेमेशन हो रही है। इसी तरह रेडनेस, स्वेलिंग और ये जो छोटी छोटी चीज़ें हैं ये भी एक्यूट इन्फ्लेमेशन के साइंस एंड सिम्टम्स हैं, तो आपने इन्हें जहन में रखना है। फिर बात कर लेते हैं ट्रांसड्यूरेशन की। ये भी बिल्कुल सेम चीज़ है, ये भी वो फ्लूइड है दैट इज़ रिलीज इनटू द एक्स्ट्रा सेलुलर प्लेसेस। जस्ट द डिफरेंस इज़ दैट कि ये जो ट्रांसड्यूरेशन वाला जो फ्लूइड जो बाहर आएगा उसके अंदर प्रोटीन की कंसनट्रेशन कम होगी, वाटर की कंसनट्रेशन ज़्यादा होगी। सो इसमें प्रोटीन हमारे पास क्या होने वाली है, कम होने वाली है, वाटर ज़्यादा होगा, प्रोटीन कम होगी। ठीक है। और वाटर की ज़्यादा होने की वजह से हाइड्रोस्टैटिक प्रेशर या ऑस्मैटिक प्रेशर भी ज़्यादा होगा। अब नाउ द मेजर क्वेश्चंस दैट केम इन आवर माइंड इज़ दैट why the protein concentration is low in case of transudation. Yes, this is the major question that should came in your mind. So actually, due to high concentration of water, uh, what so and the transudation and this kind of process, like the when we have high water concentration, it means we have high osmotic pressure. Osmotic pressure means the pressure exerted by the water, and this kind of things occurs in the non-inflammatory conditions, some condition in which no inflammation occur, for example like the heart failure, for example a liver failure, and you can say kidney failure. These are the major organs when they fails. So this is not you can say inflammation. ठीक है, heart failure is not due to inflammation, liver failure is not due to inflammation, it is other than, it is non-inflammatory disorders. सो जब ये डिज़ॉर्डर्स होते हैं, जब आपका किडनी फेल हो गया, लिवर फेल हो गया या हार्ट फेल हो गया, तो इन डिजीज़ की वजह से आपकी डिक्रीज़ हो जाती है प्रोटीन सिंथेसिस। और जो प्रोटीन सिंथेसिस कम होगी और प्रोटीन की एक्सक्रीशन ज़्यादा होगी, यानी प्रोटीन आपकी बॉडी से ज़्यादा एक्सक्रीट हो जाएगी, तो क्या होगा, यही होगा कि आपकी बॉडी के अंदर प्रोटीन की कंसंट्रेशन कम और वाटर ज़्यादा हो जाएगा। ठीक है, प्रोटीन की सिंथेसिस कम और एक्सक्रीशन ज़्यादा हो जाएगी, जिसकी वजह से बॉडी के अंदर ट्रांसुडेशन होने लगेगी। So always the exudation occur in the case of inflammation, while the transudate occur in the case of non-inflammatory diseases like heart failure, liver failure and kidney failure. Now someone can ask you, he can ask you, like for example a patient who have a kidney failure and now what kind of processes occur, did the exudation occur in her body or did the transudation occur in her body? So you have to say this is transudation, because whenever kidney fails there is decrease in the protein synthesis, and whenever protein synthesis is low it means we have transudation, not the exudation. And exudation is always occurring in the case of acute inflammation. So the patient who have acute inflammation, they never ever undergo the transudation. Transudation is not the component of acute inflammation. In always acute inflammation there is high protein concentration, and in relation with the protein the water concentration is a little bit low. So this is the major thing that I want to tell you. Okay, so in the case of exudation, so now move toward this case back. So in exudation, you have high osmotic pressure. Okay, so in the case of transudation, you have low osmotic pressure because the water is high. Water is high and the protein is low. That's why the osmotic pressure is low. Here the water is high. That's why the osmotic pressure is high. And why the protein is higher, here we have see the reason of low proteins. Here, why high protein concentration is high? It is high due to vasodilation, due to stasis of the blood, accumulation of the blood, or due to increase in the retention time of the blood. Okay, but the RBCs cannot move out because of the large size. Only plasma proteins came out. So exudate is a protein rich fluid, while the transidate is a low protein fluid accumulation. Okay, so this is the major thing, that the protein concentration increase in the exudation due to vasodilation, increase in the blood flow due to stasis of the blood, and due to increase in the retention time of your blood. So these three things are very important for the viva. They could ask you why the concentration of protein is high is in the exudation. Three points you have to give them: vasodilation, stasis, and increase in the retention time of your blood cause the exudation in case of acute inflammation. So this is the major thing. Now they have explained diagram within your Robbins book, and you can see here in the normal state, like I can draw here the diagram of exudation so that you can easily understand the exudation and transudation process. So they have, first of all, they have drawn a normal blood vessel having normal all the things. It has a lot of plasma proteins in it, and it has low colloidal osmotic pressure. OP mean osmotic pressure, low colloidal osmotic pressure, and high hydrostatic pressure. Hydrostatic mean pressure means high water concentration, or osmotic pressure mean low protein. ठीक है, ये नॉर्मल स्टेट होती है जिसके अंदर ट्रांसलेशन के प्रोसेस में प्रोटीन बहुत ज़्यादा कम हो जाती है, लेकिन नॉर्मल स्टेट में थोड़ी कम होती है, इतनी नहीं। तो ये है हमारा नॉर्मल स्टेट। ठीक है, उसके बाद बात कर लेते हैं ट्रांसयूडेट की। अब ये होगा ट्रांसयूडेट का प्रोसेस। इसमें क्या होगा कि ये ओपी बहुत ज़्यादा कम होगा बिकॉज द प्रोटीन सिंथेसिस इज मोर लोअर। ठीक है, एक नॉर्मल हद से ज़्यादा एक चीज़ का कम हो जाना भी एबनॉर्मेलिटी है, और एक नॉर्मल हद से ज़्यादा हो जाना भी एबनॉर्मेलिटी है। सो ट्रांसयूडेट में प्रोटीन्स बहुत ज़्यादा कम हो जाती हैं, और हाइड्रोस्टैटिक प्रेशर ज़्यादा का ज़्यादा ही रहता है। सॉरी, आर नहीं पी आएगा यहाँ पर, ही ठीक कर लें। ठीक है, फॉर एग्जांपल जैसे कंजेस्टेड हार्ट फेलियर का केस है, उसमें यही हुआ होगा। ऑस्मेटिक प्रेशर बहुत ज़्यादा लो, हाइड्रोस्टैटिक प्रेशर बहुत ज़्यादा हाई होगा। बहुत सारा जो फ्लूइड है या जो भी सारी चीज़ें हैं वो ज़्यादा बाहर आ जाएंगी इस तरह करके, और प्रोटीन्स जो हैं वो कम होंगी, प्रोटीन की सिंथेसिस भी कम होगी, प्रोटीन का लॉस ज़्यादा हो रहा होगा। चाहे वो हार्ट फेलियर का डिजीज़ है, चाहे वो लिवर फेलियर है, चाहे वो किडनी फेलियर है, तीनों डिजीज़ में यही हो जाएगा, और लो प्रोटीन कंटेंट होगा। और ना सिर्फ प्रोटीन कम होंगे बल्कि सेल्स भी कम होंगे, यहाँ पर सेल्स भी कम आएंगे। ठीक है, अब बात कर लेते हैं एक्सुडेशन के प्रोसेस में। तो एक्सुडेशन के प्रोसेस के अंदर क्या होगा, मैं यहाँ पर ये एक्सुडेट की ब्लड वेसल है। ठीक है, यहाँ पर क्या होगा, एक्सुडेशन यानी एक्यूट इन्फ्लेमेशन हुई हुई है। ठीक है ना, तो यहाँ पर क्या होगा कि फ्लूइड के साथ साथ प्रोटीन की भी लीकेज होगी। यहाँ से पानी नहीं आएगा, प्रोटीन भी आएंगे। ठीक है, तो मोर प्रोटीन रिच फ्लूइड जो है वो एक्यूमुलेट होगा एक्सुडेशन के प्रोसेस में। वैसोडाइलेशन हुई भी होगी, स्टाइसिस हो गया होगा, और यहाँ पर जो एपिथेलियम है उसके दरमियान में ऐसे स्पेसेस होंगी, तो इस तरह की स्पेसेस आप देख रहे हो ना, क्योंकि इन्हीं स्पेसेस से ही ये प्रोटीन बाहर जाएगा। ऐसी ये एक पतली सी यहाँ पर मेम्ब्रेन होगी। ठीक है ना, यहाँ पर एक पतली सी ऐसी मेम्ब्रेन होगी, ये इतनी पतली होगी कि ये जो प्रोटीन है ये इसे इजीली पास कर जाएगा, एंड दैट विल रिजल्ट इनटू अ एक्यूट इन्फ्लेमेशन। ट्रांसुडेशन में क्या हो रहा था, ओनली द फ्लूइड इज coming out. This is the only fluid, no protein. But in the case of transudate, the fluid comes along with the proteins, and the protein rich fluid is excreted out into the extracellular spaces. Okay, now I think now you have understand how the vascular permeability increase and how the process of transudation and exudation is occurring. Now we will see the mechanism of action, that how the vascular permeability is increasing, how these kind of things are, and what kind of mediators are involved in it, and then we will see our other things. So I'm gonna to raise it out and then writing the mechanism of action of vascular permeability, how the vascular permeability is occurring. ठीक है, vascular permeability VP. Okay, so first thing that is occurring is your endothelial cell contraction. Your epithelium cells vasoconstrict only. And how? By some mediators. What kind of mediators are there? Because we have to create the gap, as you have seen in the process of exudation. These are the endothelial cells, and we have created the gap between them so that the protein can easily extracted out. After studying the exudation and transudation, keep the exudation in your mind, because we are studying acute inflammation, and in the case of acute inflammation, the exudation is occurring. So that's why we have to contract, vasoconstrict the epithelium cells. When these epithelium cells contract, first of all, they are vasodilated. Like see in this area, they are vasodilated, vasodilated, vasodilated. ठीक है. Now we have to contract it. और जब ये contract होंगे तब ये कैसे आएंगे? तब ये इस तरह से आएंगे, इस तरह जैसे पहले वो फैले हुए थे, अब वो नहीं होंगे और इनके बीच में गैप बन गया, जिससे प्रोटीन जो है वो बाहर आ जाएगी. And what kind of mediators are involved in it? So a lot of mediators are there. So please remember the names of all mediators that are doing it. So the first mediator is cytokines, most important mediator of acute inflammation. You will study it at every line, at every part. Whenever the mediator word came, cytokines is there. So keep it in mind. And the major cytokines, the major example of cytokines is the TNF, alpha and beta, you can say, and interleukin 1. Interleukin 1 is a major cytokine of your acute inflammation. Very important, and keep it in your mind. Okay, the second mediator that involved in it is the histamine. As I have said, that the vasodilation is occurring due to histamine, or you can say nitric oxide, but the major role is of histamine. It is the important component to cause the vasodilation. Third is the bradykinin. We have studied about the bradykinin. It is an inflammatory protein that is synthesized within our body due to the process of Callan system, and some leukotrienes. These are the inflammatory mediators. So they are causing the vasoconstriction of endothelial layer, so that the gaps created in it, and whenever the gaps create, their permeability increase. And one major important thing, these gaps are very short lived. They are for some time, not the whole life. They are for some time, like they just take only 15 to 30 minutes to create the gap. And this is the important thing. If this gap remains the permanent, if this gap remains the permanent, then all the protein present in your blood vessels, all these protein moves out, and your blood will become empty. The blood will contain no protein in it, and then the patient can die. So that's why the body is also protecting it. So that's why the vasoconstriction of endothelial layer is only occurring for 15 to 30 minutes. After 15 to 30 minutes, it will end up. Okay, so this is the major thing, that always the epithelium concentration is short-lived, vasoconstriction is short-lived, and it only occurring for 15 to 30 minutes, and after that it will end. Okay, And you have to remember the mediators of it: cytokines, histamine, bradykinin, and leukotrienes are involving in it. So someone can say, for example, a patient having the high concentration of cytokines, it means his epithelium vasoconstriction chances is very high, and very high chances that he can get the acute inflammation. And the second major step of your vascular permeability, first is the epithelium vasoconstriction, and the second step is increase transcytosis. Increase ट्रांससाइटोसिस. ट्रांससाइटोसिस इट्स मीन कुछ मेडिएटर्स बढ़ जाते हैं जिनकी वजह से प्रोटीन की ट्रांसपोर्टेशन बढ़ जाती है. साइटोसिस अपने नाम से बता रहा है. ट्रांस मीन ट्रांसपोर्ट करना, साइटोसिस मीन किसी सेल को, किसी प्रोटीन को. सो ये कुछ मेडिएटर्स हैं, मेडिएटर्स जिनको हम कहते हैं VEGF. Due to these mediators, there will be increase in the transportation of protein, and there will be increase in the vascular permeability. So this is the how your vascular permeability increased. Your epithelium will contract. Your transcytosis will increase. That result into the increased vascular permeability. Due to increased vascular permeability, transudation process will occur, and the swelling will occur at that side. And how the vascular changes occur, we have studied. Vasodilation is occurring there, endothelial cells are activated there, that cause the lymphocytes to attach themselves with the wall and increase their migration. And then we have increased the vascular permeability, we have studied it. Now in your book they have given another short thing which is important for just for your concept. This is the response of lymphatic vessels. We are studying the blood vessels, and our body has another circulating system which is the lymphatic system. Okay, and lymphatic system has the lymphatic vessels in it. So we are checking the response of lymphatic system, or you can say lymphatic vessel. So how it will respond when you have acute inflammation in your lymphatic vessels. So your lymphatic vessels play important role in the inflammation. You cannot say that the lymphatic system is not a part of inflammation. It can be, okay, and it can cause the edema or debridement. Severe inflammation can cause the involvement of lymphocytes and lymph nodes. So lymphatic system is mostly causing the severe kind of inflammation. In short, it is causing the chronic inflammation. They are discussing the two types of inflammation in which lymphatic system is involved. So the first inflammation name is the lymphangitis. Lymphangitis. It is the inflammation of lymphatic vessel. Lymphatic vessels के अंदर inflammation हुई है, and they make redness around the worm. So it called the redness at that side. Second inflammation is lymphadenitis. Lymphadenitis. So this is the inflammation of draining of lymph nodes leading to their enlargement, which is also called as reactive lymphadeninitis. So this is the inflammation in which our lymph nodes become lymph nodes, they become enlarged. So this is the inflammation. First inflammation is of vessel, second inflammation is of lymph nodes. They will increase their size and they become enlarged. So this is our lecture in which we have discussed the first component of the acute inflammation, which was the vascular changes. In the next lecture, we will discuss some cellular events of it, and then we also discuss it from the book also. So if you like this video, then please subscribe to it and press the bell icon so that you can get the notification of all the videos that I will upload it. Make sure to subscribe it and press the bell icon so that you can get the next future uploading videos. So take care, meet you soon, Allah Hafiz.